Here it is, Crutches and Spice, with how ableism is nonsensical.
This is how I know ableism is nonsensical.
This year, we built a ramp for our foster son who has cerebral palsy. He's deaf, he's blind. He's been living with us since January of 2015. And we had a church group come out and build the ramp for us. And within hours of building the ramp, we received a lot of complaints from the Homeowners Association.
Let me put this into perspective for you, okay? I'm not laughing at the fact that this person is experiencing inaccessibility. I'm laughing at ableists not planning for their own fucking futures, okay? Only about 20% of people in the disability community are born with their disabilities. Everyone else acquires their disabilities as they age, or they're diagnosed as they age. 1 in 5 people will develop a disability as they age, and that's a conservative estimate. Let's also keep in mind the fact that about 75% of people want to age in their homes, and only 5% of homes in real estate, right, are move-in ready and accessible, okay? I want you to take all those numbers into account. The HOA in that video may be protesting a ramp outside of a home, but they're really protesting their own goddamn future. Because let me tell you this much, if you are in a hospital and the hospital social worker, the person working on you, gains wind that your home is not accessible, guess where you're not going? Home. You're not going the fuck home. In fact, many people are remanded to nursing homes and state facilities because their home is not accessible and not suitable for somebody with a new onset disability. Now, this is even after the fact that people will go through probably months, if not years of rehab after the onset of a disability or injury or chronic illness. And what a lot of people don't know is that once you have a disability, a lot of times you become a profit center. Darling, private equity has been buying up all of our disability and healthcare services, but especially during the pandemic. You wanna know why? Well, you can do math. Mass disabling event plus governmental negligence plus public ignorance equals a cash fucking cow. And so many people are reluctant to accept the reality that you are fragile and your tomorrow is not promised. That doesn't mean that you could experience death, but also disability. So many people are reluctant to actually accept that fact, that can be one of the reasons why you're remanded to a conservatorship or guardianship and everything you own is sold out from under you. Because you not accepting that fact and building something like a ramp would mean that you cannot handle your own affairs, thereby giving people justification to do those things to you and then pay themselves from your assets, your sold off assets. And so while that group of people is sitting there protesting and saying, oh my God, it's ruining the aesthetic of the neighborhood, they are on a ticking clock. And by the way, this is not like a new occurrence. People have been protesting disabled people in their neighborhoods for decades. For decades. It's one of the barriers to disabled people moving from state-run institutional facilities to community-based living. People don't want disabled people in their communities. Full stop.
That piece about 1 in 5 people will become disabled during the course of their life, and that's a conservative estimate, that hits home. Because, like going back to what I said in the beginning, when I was caring for my grandfather just for that week, like I wasn't like a caretaker for my grandfather for any extended period of time. He came to visit us, but like my grandfather aged into that state of life. Like he was able-bodied, he aged into being disabled and literally needing me to wash him in the shower. Like that's how much care he needed by the time he got to the end of his life.
What came up for me was when I worked for a very popular I won't say popular, but lucrative. It used to start with an A, but now it starts with an E. But I used to work in their social work department. So I can speak firsthand about the fact that the hospital social worker will call me, who used to work in the social work department of the insurance company, to tell me what the discharge plan was for the member who was in the hospital. They tell me the discharge plan. The discharge plan says that the member requires A, B, and C for their mobility in order for a healthy recovery. Guess what? If their home does not have A, B, and C, because there's going to be a social worker that's going to come to your house when you get discharged. If mobility is listed in your discharge plan, a social worker is going to show up to your house, or somebody is going to show up to your house to make sure that everything is the way it's supposed to be, because if it's not, then they're liable. So when they would call me and say, well, so and so needs to come home, they have to have A, B, and C for them to come home. They need a wheelchair, they need a ramp, they need this and this and this. The difficulty of even finding resources that provide those things, and you don't have to sell one of your organs to pay for it. Help me in here, somebody, because it's out there. You can get a ramp built if you want to. You can get a medical bed for your house if you want to. You can get rails in your bathroom that you don't buy from CVS if you want to. But do you know how much that stuff costs? And when it doesn't cost and you go through a community-based program to build it, do you know how many hoops you got to jump through? You know how much paperwork and how much personal information you got to divulge just to get that ramp on your front on the front of your house, in order to make sure you can get in your house. And then when you do that, just like she said, the housing authority is going to be making phone calls because they don't like the way it looks. They don't like the way your ramp changes the aesthetic of the neighborhood. So then that's another issue. And you have people who want to recover at home, who want to age at home, who want to die at home. But if the hospital, the social worker, the hospice facility says this isn't a conducive environment for whatever accessibility reasons, they're not going to send you home, because then they become a liability. Because if you go home and your home isn't accessible and something happens to you, it's going to go back to your discharge plan. And what was on your discharge plan, and why the hospital let you go home when your home wasn't conducive for your recovery. So I know firsthand what she's talking about trying to find accessible places for people to recover, trying to help people who are disabled find accessible apartments, and calling hundreds of apartment complexes, and then they only got 2 apartments in their whole thing that are accessible for the disabled. That is, yeah, it's a lot. I could go on and on and on, just because I worked at the insurance company, knowing it's almost like they don't want you to have it. If I can be honest,
that part.
Because that's part of the reason why I had to leave that job, is because it completely goes against my moral ethic that I hold personally. It goes against my ethic as a social worker to be sitting in meetings where my profession, what I love is to help people find the resource. And I'm sitting in meetings with the medical director of the hospital, the director of the insurance company, and all of these influential people. And what they are trying to do is figure out how to not give you what you need. That goes completely against my moral compass. And I couldn't do it. So yeah, they don't want you to have the accessibility, because guess who got to pay for it? Your insurance company.
Late stage capitalism, which is what we talked about last time. Like, our health insurance is privatized, so everything's about profit. So it benefits the profit of the company to not give people the services that they need. I mean, it's a complete mind fuck.
When she was talking about the loss of autonomy with, external agencies or medical professionals being able to determine your moves, like, that shit is so real. Because when I went to the doctor the first time, when I thought I just had COVID, the stay ended up being 12 days, right? So y'all know, after day 4, I was going stir crazy, like, let me out and free my nigga Autumn. But they were not letting me out. They were literally like, we will not release you until ABCD. So every day I'm waking up, ordering my little hospital meal, which is bland and unseasoned, getting my stats. Like, I was getting blood work done like 3 to 6 times a day just to find out, like, did I make enough progress? No. You have to stay another day. I do thank God that I have great insurance, but at the same time, like, that was a whole scam to me because I had to pay $5,000 out of pocket before all the shit kicked in. So at this point in the year, I'm good. Like, I go to the doctor, no copay. My prescriptions free, but I've paid $5,000 in the copays, in the other prescriptions, in the visits,
On top of your
and
premium.
on top of it. And this reminded me of this movie, which is kind of applicable. And I'll probably talk about it more in Faith and Film later tonight. But I don't know if you've seen that movie on Netflix, I Care a Lot.
Oh God.
The privatization of healthcare is wild because predators are going to predator. So there are predators in this industry. And it is so easy to lose your rights and be a ward of the state as an adult. Like, you think, oh, foster care, children. No. If you have any vulnerability from anything that has been a disabling event, you really have to be careful because people will try to take everything that you have, even if it's barely nothing. And then they'll leave you in a facility to be cared for where it's really not the quality of life that you would deserve. Like, when I was in the hospital, they were really trying to talk to me about possibly going to some sort of place where I can get outpatient care. And I was like, I'm going to be at home, just schedule my appointments. But then even scheduling appointments was difficult because when you have to see specialists, they're not available immediately. Like, it's not like when I call my primary care and I can get an appointment next week. I was waiting 2 and 3 months to see specialists, and I'm seeing 4 different specialists. So it's just crazy the way that a disabling event, which can make you a disabled person, will literally take over your whole life. Like, I'm over here, I've had to call HR today because I'm looking at my leave like, y'all docked my pay for leave that I had. And she's like, well, you're on FMLA and your boss needs to explain to you how to utilize your leave. And I said, baby, this is the amount of hours I had, screenshot. This is the amount of hours you took. It's math. You need to give me my money back. But the things that you're subject to and the things that you have to think through and plan for in order to receive care and be well is just wild. I'm a special ed teacher by trade, so I think that I've always been aware of the ableist conversations, and I've always, in my own ways, been an advocate for disability justice, even when it didn't apply to me. But now I be on 10 because when I look around and I just see the inaccessibility or the threats to your autonomy, like, it's very in my face because I'm living through it. And it's unfortunate because it shouldn't take you living through something to become aware. But for me, that's what it did. Like, I had a working knowledge, but now it's more of a priority because it applies to me. And I think that's why when we look at wanting experts and all these different topics we talk about, it's like we want to include people, but at the end of the day, we want each of us to understand our lived experience because it applies, and we need to be vigilant in order to survive and thrive.
My office is inaccessible. My office is on the second floor of a building with no elevator or escalator. So in order to get to my office, you got to walk upstairs. And I have a disabled client who's like on crutches, and he hasn't come to see me in like 2 years. And I think it's because it's so difficult to get into my office. And he didn't like tell me that, but I know it's been a struggle for him to come here because of that. And when I got this office, I didn't even think about it. It didn't even cross my mind when I got this office. It's like, oh, 1 flight of stairs? No biggie, I'm good. But like, I wasn't even thinking about the fact that my clients might not be able to do this.
Accessibility in healthcare should be a human right, full stop, period.
Yeah.
None of this should be happening at all. And there are other places in the world that have figured it out. Like, this isn't hard. This isn't a challenge to figure out. I also found myself not surprised by, but just so angered when she talked about the people who were buying up all of the care homes, and just how disgusting it is when people take advantage of vulnerability.
Hey, thank y'all for watching this segment all the way through. The entire recording of this episode is exclusively available in our digital community. You can subscribe by visiting holysmokesmovement.com and just click join our digital community. And if you enjoyed this segment, I'm sure you're going to enjoy the 2+ hour recording we did on this topic. But not only that, you'll have access to the TFC ecosystem where hundreds of us discuss these topics every day. And not only that, you can watch all of our full-length podcast recordings on demand in our digital community. And not only that, you can get the gratification of supporting a movement that's supporting you. And who doesn't want that? So again, holysmokesmovement.com, click join our digital community. And don't forget to subscribe to our YouTube channel if you want to get more free content from us just like this. And we'll see you right back here next time, where we are deconstructing harmful theology and building beloved community one cigar at a time. But like, you did know, you don't have to smoke cigars to be a part of this, right? Like, only 15% of our community smoke cigars. I'm just saying.